you have a diagnosis of an ulnar collateral ligament tear of the elbow. This is otherwise known as the Tommy John injury. This injury most commonly occurs in overhead athletes who exert very high degrees of force and velocity across the inner side of the elbow. We most commonly see them in baseball pitchers. It can occur in pitchers of virtually any age, but it most commonly occurs in individuals who are skeletally mature where the growth plates are closed. This has been a bit of an epidemic. It has been associated with exposure to hours of activity and has been benefited by focusing on pitch counts and material changes in our overall restrictions in our young athletes. That being said, ulnar collateral ligament or UCL injuries still are occurring at an alarming rate. In the past, we would try to treat these routinely without surgery, and there still are some patients with an ulnar collateral ligament tear or a UCL tear that can respond favorably to non-surgical intervention. Unfortunately, the vast majority will need surgery to either repair or replace the torn ulnar collateral ligament. Non-surgical treatment might include the use of platelet-rich plasma. Platelet-rich plasma is a procedure where we take blood, spin it down in a centrifuge, obtain an elevated concentration of platelets that have important growth factors that might stimulate healing. Certain tear patterns might be amenable to that. We will discuss this in the office in association with a review of your MRI to determine if non-surgical treatment is properly indicated. The most common treatment for a ulnar collateral ligament tear is surgical intervention. The procedure involves reconstructing the ligament, typically using a tendon that we obtain from the wrist. This is called the palmaris longus. On occasion, we might use a hamstring tendon taken from your knee or even a donor ligament called a ligament allograft. The procedure itself takes less than 1 hour in general. It involves an incision on the inner side of the elbow. We typically will identify the ulnar nerve, which is a nerve that runs along the inner side of your elbow, otherwise known as the funny bone nerve, to identify and protect it during the course of the surgical intervention. The procedure typically involves drilling a tunnel in the ulna, which is the bone on the inner side of your arm where the ligament inserts, and a second tunnel on the end of the humerus. We essentially place or dock the ligament in a socket that's drilled in the ulna, which is the bone on the inner side of your arm, and the end of your humerus. The surgical technique has evolved over time, and fortunately the surgical outcomes have been very high, sometimes in the neighborhood of 85%, including the highest level athletes such as Major League Baseball pitchers.